We've got a fantastic panel coming up right now. And we're very fortunate to be led by our tremendous moderator, Anne-Marie McLaughlin. She's the Director of Emergency Management and Continuity at NYU. And she's going to lead us on a topic that's been, I think, just front and center on every newspaper and news outlet. That's active shooter awareness. So Anne-Marie, I'll turn it over to you.
Thanks, Vance. I appreciate it. My name is Anne-Marie McLaughlin. I use she, her pronouns. I am a middle-aged white female with curly red hair. I wear glasses, and today I've got a light blue blazer on. I'm the Director of Emergency Management and Continuity at New York University. I'm also chair of the IAEM Accessibility and Whole Community Inclusion Caucus. Sadie Martinez is my vice chair, and I just have to say we are so grateful to Vance for asking us to collaborate with him on this amazing symposium. I'm also grateful to Vance for assigning me to this particular panel. I've been engaged in inclusive active threat preparedness training and exercises for over a decade. First at the University of Massachusetts in Boston, through the Boston Consortium of Higher Ed Emergency Managers Group, and now at New York University. Active threat scenarios, as Vance mentioned, are at the forefront of the news. If you go to the FBI website, the statistics are sobering. These events are on the rise. This panel is going to focus on how we prepare the whole community for surviving an active shooter threat. How do we prepare first responders? There are a lot of materials out there, both for responders and for civilians, but sadly, not all are inclusive. I got into this starting back 2012 is when Ready Houston put out the Run, Hide, Fight video. And around that time, I was doing a lot of active threat preparedness training at the University of Massachusetts in Boston. If you know the university, you know it's a public research university, around 18,000 enrollment, incredibly diverse, welcoming to veterans. We would do active threat trainings for large groups. I would partner with our UMass Boston police. And if you know anything about people from Boston, they're a lot like people from New York. It's a generalization, bear with me. But if they have a problem with something that you're saying, they will let you know. So I found myself very often at the front of a big room full of people with someone raising their hand saying, this is not helpful to me. And what could I say? We would often recruit people with disabilities, access and functional needs to be role players in the annual active threat exercises that we did for UMass Boston Police. And I'll never forget, I used to commute with a colleague who uses a wheelchair, Chris Goldie, and I would try to talk to him on the train and say, hey, you know, we're doing this exercise, maybe you'd wanna participate, because again, at the time we were looking, you know, after a couple of people said, excuse me, this isn't helpful to me, we were looking for guidance. We weren't finding a lot of guidance. So our approach was let's involve people and let's see what we can learn by creating a safe environment. And we wanted to recruit people. And you know what he said to me? Never forget it. Anne-Marie, why would I do that? There's an active shooter, I'm just gonna die. I know that. And I've held that with me till this day. Because if our training is discouraging people instead of encouraging people, there's something wrong with our training. We need to do better. And so today, this last panel, we're going to talk about how do we prepare our communities? How do we improve response? We have incredible expertise and leadership with us today. We're going to introduce our panelists. And as I introduce you, we'll invite you to put your camera on, and we'll start out with Vance Taylor. Of course, you know, Vance, the man who needs no introduction, Chief of Office of Access and Functional Needs at the California Governor's Office of Emergency Services, Cal OES. He's been a national leader in this area, certainly as long as I've been involved in this. And if you missed his keynote yesterday, please, make sure to find the recording and listen to it or watch it. Incredibly powerful. Also with us, we have his colleague, Aaron Carruthers. Aaron is Executive Director of California State Council on Developmental Disabilities. He has worked in civil rights policy and programs for over 20 years, including as an appointee of 2 governors and for Governor's Attorney General, California's Attorney General. He's currently carrying out the council's goals of housing, employment, and safety. Last year, his team's work impacted more than 2.4 million Californians. Also from the state of California, we have Dawn O'Keefe, the Chief of the California Governor's Office of Emergency Services and Homeland Security. Chief O'Keefe's primary responsibilities are to coordinate statewide law enforcement mutual aid, search and rescue, mass fatalities, and other public safety threats against the people of the state of California. We also have Mark Sloan. He's the Homeland Security and Emergency Management Coordinator for Harris County, Texas, serving over 4.8 million incredibly diverse residents covering nearly 2,000 square miles. He serves on the Department of Homeland Security's First Responder Resource Group, representing the National Emergency Management Discipline, discussing potential needs of emergency managers and the other first responder disciplines. We have an experienced and knowledgeable panel. When we're going to start out with Vance, and I have to say, when we were developing our inclusive active threat video at NYU, we were looking for guidance, and it's so important to try to find authoritative guidance when you are developing materials. And I'm so grateful to Vance for assisting us with this video. And Vance, just to start off with you, when Cal OES released its active shooter awareness guidance, it was the first ever integrated product of its kind in the nation. What moved California to develop it, and how did you get stakeholder buy-in?
Yeah, no, great question, and you're right. And thank you for your very generous comments. You are an absolute leader on this front, and just delighted to have you as a moderator. Of course, we're joined by my fellow panelists. Everybody else has been describing themselves. I realize I should probably do that. So I'm a light-skinned Latino individual with, well, frankly, I'd say peppered hair, but there's a little more salt than pepper these days, it feels like. And I'm wearing a purple necktie. Yeah, so to get to your question, what happened was that in 2015, terrorists attacked a regional center in Southern California. And of course, the center serves individuals with intellectual and developmental disabilities. And initial reports indicated that it was an attack on people with disabilities. And later we learned that wasn't exactly the case. But obviously it raised some very serious concerns. And that afternoon, I remember I met with our agency leadership and was discussing those concerns. At the top of my list was the fact that there was a real gap between the access and functional needs related considerations associated with an active shooter event and what actually was created to help people prepare to respond and recover in that event. I mean, specific to the point, right? The mantra is run, hide, fight, which I looked at, and as somebody that uses a power wheelchair, you lost me at run, right? I've read the material, I'd seen the video that DHS put out. If you look at that video, at the time that one came out, there wasn't a single frame that showed somebody with an access or functional need. You had kind of these quasi-Olympic athletes that were sprinting out of rooms and diving over tables and that just wasn't me. I didn't see myself in that. And yet, it's people with disabilities, it's people with access to emotional needs. We go to work, right? We shop at malls. We go to hotels. We're everywhere else, and everywhere that any other individual is, right? And so we're just as likely to be at the same risk to be in that type of an incident. And the thought just kept coming, well, shouldn't everyone be empowered with this information? Right? Shouldn't everybody have guidance and training? Of course, right? So from that moment, Cal OES was committed that we were going to get there, but recognizing and committing to address the gap was one thing. Of course, trying to figure out, well, how do we do that? Right? That's something else. I was very fortunate that at the same time that this discussion was happening, I heard from Aaron Carruthers, who's the executive director for the State Council on Developmental Disabilities. And the council were also very concerned about what had happened that day. And they wanted to see action taken, and they wanted to be a part of the solution. So it should come as no surprise that when we formed this active shooter awareness work group, that the first person I called was Aaron Carruthers, right? And so that was our approach. We brought together the council, we brought together law enforcement, we brought together regional centers. We had the California Specialized Training Institute at the table. We had representatives from independent living centers. We had emergency managers. We had as diverse a group as possible. And what ultimately came, of course, is a product you talked about, which was the first of its kind product, right? The first ever active shooter awareness guide. So that's sort of the impetus that pushed us forward. And then, of course, we worked through the process that ended up on the final product. But we did it together.
That's incredible. And, the fact that there was a guide out there really made an impact nationally, right? And I think it's been a while since that's been out there. I know we used it, and I'm going to share the NYU video if folks might find that helpful. But, Vance, in what ways do you think California's guidance has helped move the needle on this issue nationally? I'm sure others have also looked to this guidance.
Yeah, so one of the best things that's happened is that it's forced a conversation, right? And the idea was, hey, if you want to take this integrated guidance and you want to just copy, paste, and print, if you want to incorporate it into your training, great, take it wholesale. But if you want to build on it, if you want to refine it, if you want to tailor it, then please do that too. And we saw other groups come to the table, and you were right at the forefront of that, right? You looked at it and said, hey, this is something the university needs. And so we saw New York University take, use as one of its foundational pieces what we had developed, and then build on it and develop videos that were inclusive, that were dynamic, that were vibrant and relevant for not just university students, but for staff and anyone that would be on campus. And so we've seen other states and other jurisdictions that have brought their stakeholders together, and they're working with law enforcement maybe for the first time, right? And what's been wonderful is not just is that the trust develops as that relationship that's been created, but that you see sort of this understanding that happens on the part of each stakeholder. So law enforcement, for example, at first were concerned about tactics, right? We have a very specific set of tactics and we don't want to change those tactics necessarily. And the conversation became about not how do we change tactics, but how do we make sure that when you're trained and when you go into a situation, that you're as informed and empowered as possible to ensure that when you yell, "Hey, hands up," and somebody doesn't do it, that individual maybe is because they have a disability as opposed to because they're a threat. And so we've also seen that once people get comfortable working with law enforcement, that helps in every other aspect of emergency management too. So it's been pretty great. And I think that that's one of the best things we've seen happen in terms of movement nationally.
And this really goes back to that idea that we talked a lot about yesterday, planning with and not for, right? And talking about working with law enforcement. Valerie Haven, who is active up in Region 1, she was a disability support person at UMass Boston. She's blind. She went back to school, got her master's degree in emergency management. She was the first person to volunteer to be in our exercises. And I'll never forget, she was in a room, the bad guy was in the room, and the young police officers come around the corner and they're ready to get the bad guy, and they get the bad guy, and then they're sweeping the room. And Valerie has her cane and she calls out to the officer, "I'm here, I'm blind, I have a cane." And the look on the officer's face, clearly it was a learning moment. And, you know, it's such an important partnership with law enforcement. And so I'm going to move to Chief O'Keefe. And just, if you don't mind telling us a little bit about what role law enforcement plays in advancing this whole community safety for active shooter events.
Thank you, Anne-Marie. Can you hear me?
Yes, sir.
Okay. Well, first of all, I thank you for inviting me to this distinguished panel. So a lot of what we do to promote safety among individuals with disabilities and anyone with an access or functional need during an active shooting, and it actually happens in advance. I was listening to the prior panel, and one of the things that, you know, goes over and over again is you got to develop those relationships. You got to have, in law enforcement, have to reach out to to the schools, to other areas that may have a problem with an active shooter, to understand, what the issues are. So when we train officers and responders, access and functional needs are included in the curriculum. In fact, we just redid ours with the Help Advance at Cal OES specifically to address the access and functional needs. That is so important. I've been involved in several situations, potential school shootings and some shootings where, that's just not the case. It wasn't planned for, and there was a lot of misunderstanding and of that. So we also outline the access and functional needs and considerations. We discuss best practices for communicating and interacting with people with disabilities. We work with disability stakeholders to build trust and enhance, law enforcement's, core competencies. All those factors come in to play when we're in an actual event. And again, I will say, those relationships are extremely important. We want to prepare for the broader view or understanding of what and who we may encounter on the scene. And lastly, I'd say, we work to ensure that life-saving information gets out to the public via press conferences, alerts, warnings, and notification, using accessible platforms and resources that get to all, the target population. So that's a few of the ideas that I have on that.
It's a lot, right? So it's preparing people beforehand and building those trusted relationships. Do you have any advice for law enforcement, across the country, for someone from law enforcement listening to this? How do you build those trusted relationships? How do you get people in the room so that, you can have those important discussions before to prepare the community?
And that's a great question. And I think what we've seen in the last few years, I think people that were reluctant, to come together before are now willing to come together. It's a matter when I was a police chief in a city, it was a small community. When we had some incident that affected the whole community, it was interesting how they would all come together, but not always on others. So I think that the way to do it is just it takes more than two. I mean, obviously someone can talk, someone needs to listen, but I think we need to develop a forum in which everybody has a voice at the table to talk about their concerns. And it's just not one side that should be bringing this to the table. So I just look for opportunities within the community, because as we know, all emergencies they start local and they end local. And I would look at bringing a diverse group to the table. And in some cases, if there's, certain part of the population that has a distrust of law enforcement, maybe the person who's organizing this will not be law enforcement. It will be someone that maybe the community has more trust in. So that's just a few thoughts I have.
That's a great idea. And I think, this necessarily involves partnerships, right? Because when you talk about people who are experts at access and functional needs are likely not to be also expert at law enforcement active shooter response tactics, right? And then discussing the different types of disabilities, it gets even more complex, and there's such a need for collaborative planning. Law enforcement does have a primary role in responding to an active threat, and it may not be, people may not know what that involves, although as we're seeing more and more discussion in the news, maybe we're all getting more educated. But how would you describe law enforcement's primary role during an active shooter attack, and how access and functional needs factor in?
Well, the primary role of law enforcement is to respond and stop the threat as soon as possible. I think we saw in Uvalde there was a certain breakdown. Or there was a breakdown. Let's face it. Let's put it on the table. It started out as an active shooter incident. Then for some reason they thought it was a barricaded suspect, but there was a lack of command and a lack of leadership. And unfortunately, you saw what happened. But the primary role is just to get there, put your team together. Usually it comes in, when law enforcement arrives, it could be different law enforcement agencies. They usually put the team together, usually right around 4 individuals. You don't want it too big, you don't want it too small. But literally law enforcement's going to arrive on the scene, and someone has to take charge, and it may not be the primary jurisdiction. Somebody needs to take charge, and okay, let's get a team together and let's go. Let's go in. That's the way it should work. And that's how a lot of the law enforcement training, is conducted. So the officers may be in regular patrol uniforms or wearing external vests, tactical vests, helmets, maybe carrying a shield, we call, a rifle. And officers, when they go in, they're going to shout commands, provide nonverbal instruction, and may even push individuals to the ground for their safety. And I have to say, in these situations, I mean, it is chaotic. It's going to be very chaotic. And, during our training in law enforcement, we have to understand, and I think to Vance's point, you're going to have situations where people cannot follow your directions. And in some cases, they're hearing you. They may be looking at you, but not hearing you because they're in shock. So we need to take that into consideration when we're coming across, individuals during an active shooter situation. It's not that they don't want to comply, it's that they may not be able to comprehend what you're asking them to do. So, we tell it, the officers that, in some cases, not use, obviously not use bad language, or, just take in the back of your mind, just realize that they may be in shock and they're trying to, but they just are incapable of doing it. So it's just something we need to keep in the back of our minds. And in terms of how access and functional factors, we train officers on the importance of understanding, like I mentioned, accounting for, and appropriately addressing the access and functional needs. And, to Vance's point again, if someone's in a wheelchair, they're not going to be able to run. So, we've got to make sure that when our training that we do address these type of potential situations that are going to come up. You know, we work with stakeholders to ensure the community understands how individuals in an active shooter situation can assist law enforcement, you know, during the incident. And generally what will happen is, you know, when possible, put your hands in the air, you know, spreading fingers, all these commands are going to be given. And so, you know, we, during the training, this is what we train, like in the school shooting situation, we do school training, you know, we talk to the staff and to, you know, the children, this is what's going to happen in this situation. So I guess there's a lot of, it's chaos when these things happen. And I think, you know, on both sides, you know, we need to try to understand that, you know, people want to cooperate, but there may be something limiting them from doing that. So those are some of the things that, you know, what a primary role with law enforcement and how it's going to come across, especially with access and functional needs.
Thank you, Chief. It's so complicated. Right? There's training for the officers and there's also training for civilians. And I have to give a shout out to Rob Sampson at the Massachusetts MBTA Transit Authority. They do exercises and they bring lots of people with access and functional needs into the exercise to, again, help officers who are, you know, practicing their response, be mindful of the diversity of clientele on the trains. Going back to, you know, sort of the police response, and then in the aftermath of an incident, there is a lot of discussion and interest in planning. And Vance mentioned an event in California that brought him and Aaron together planning. Aaron, would you want to go back to that event and talk about how you got involved? How are you involved in that response, very exciting event in 2015?
Thank you so much, Anne-Marie. Hi, everybody. This is Aaron Carruthers from the California State Council on Developmental Disabilities. I am a white male in his late 40s, barely holding on to 40s, with all gray hair. I'm wearing a blue blazer and a white shirt. My background is a photo of the California State Capitol along with a logo of the State Council on Developmental Disabilities. I'm calling you actually from a hotel conference room in DC, where the lighting is very off and I look very pale and washed out. Anne-Marie, thank you so much for the question. The regional centers for those in other states are how services are delivered to people with developmental disabilities. It's part of the chain of services. So dollars come in from the federal government paired with dollars from the state, given to the State Department of Developmental Services, who then gives it to 21 regional centers who they then contract with vendors to provide services. So a regional center isn't necessarily a place that's providing direct services. It's more of, they do the service coordination, the case management for people who have needs. And our office in San Bernardino is just a mile away. For the Inland Regional Center, we know them, had staff who've worked there. And when it was happening, we happened to just, because we know people there, we're on the phone with people who are live on the ground, and we were helping manage incident response as it related to getting people out of the building. We knew the physical area, so advising them on where to evacuate across the street. So there was an in-the-moment response. There was the next day response as we worked with the executive team there to provide our offices in San Bernardino any resources we could so that they could do what they needed to do to come back together and keep business moving. But then there was also the community response. Now that we know active shooters is just part of our regular routine existence, how do we prepare for them in the same way that we prepare for a natural disaster like a wildfire or an earthquake? So how do we prepare for a man-made disaster? That's when we reached out to the Governor's Office of Emergency Services and appreciated Vance's leadership in responding very, very quickly to say, let's come together. Let's find a way to take the national guidance and adapt it. What's interesting is so much of the conversation so far has been how does law enforcement adapt? That's one piece of the puzzle. Another piece is how do employers adapt? Because often the active shooters are at workplaces, and employers need to be ready, and they need to be adapting for not only all their employees, but also for employees with access and functional needs. And then there's a third group, and those are people with access and functional needs themselves. They need to learn, prepare, and be ready for how, with their abilities, are they going to run, hide, or fight? As Vance says, you lost me at run. And it's a really good, quick way to communicate the challenge of the overly simplified directions we get of run, hide, fight. But I also know Vance. And if we were in that situation together, if the shooting was happening and it was far enough away, he and I would be running. To me with my abilities, him with his abilities, and us together, if we could. Of course, we'd assess the risk, figure out, could we get out, and then we'd run together. Part of it also gives an example of preparation, partnering, planning. Those are some key elements for people with access and functional needs when thinking through different scenarios. So for the incident that happened in 2015 at the Inland Regional Center, that's how we got involved. But I about some of those other details.
That's very helpful. And I think that, oops, I'm getting a little bit of feedback there. You know, as we're thinking about preparing for the whole community, Aaron, something came up in the last session, you know, about people will tend to focus on one type of disability or another type of disability. And when we think about, you know, people with developmental disabilities, I don't know if they are often left out of the planning, but is this something that the people with developmental disabilities, you know, are thinking about? Clearly they have, you know, they're thinking about housing and employment, but there's also this area of safety. Is this a real concern, and how are their needs best met?
That's a very insightful, complex question, and Marie, I really appreciate that you're thinking on, you know, if as a person with a developmental disability, what's the entirety of the needs that I have in my life to be independent, to be successful, to live a life without boundaries and barriers to the best of my abilities. At the State Council on Developmental Disabilities, we're created by Congress. We're a line item in Congress's budget. I'm actually here in DC with the meeting of our National Association of all the DD councils from around the country. Part of what we do is we ask the community, what do they want us working on? What's important to you? And you drive our work for us. So every 5 years we create a plan. It's our state plan, and we just send out a survey. What would you like us working on? And so I can answer your question with evidence, empirical evidence of responses. And I can tell you in order of responses, the people with developmental disabilities for our last 5-year plan, there's about 6,300 voices represented in these responses. Number one answer was housing. Second answer was health and safety. Third answer was employment. We can look at these numbers even further and say, well, who's answering what? What's a priority for who? And when we look at family members, what did family members say? Health and safety was the number 2 answer. So their concern about the safety of their loved ones was their second priority out of 12 different areas we measured. Talking to people with developmental disabilities, their answers in order were employment, housing, and then health and safety. So you say among all the many things that are on people's minds, where does safety rank? It's right there. It's at the top. It's at the top over protect my benefits. It's at the top over the transportation system's completely dysfunctional and I can't get from A to B. It's at the top over the educational system. Going through special education doesn't actually meet my needs. So I think we all intuitively know how difficult those areas are. And safety ranks above that. Of course, I report to a council. It's 31 appointees by the governor. And let me tell you, safety's on their mind too.
Very important. And going forward, Aaron, what's the next frontier in safety and emergency response for California? Yeah. So just generally, I mean, if we're in a national symposium here, and as folks are thinking about this, you know, what's on the frontier?
As a national symposium, I can tell you again, among my peers here in DC, as I talk to other executive directors from developmental disability councils, safety is on everyone's mind. Extreme weather and climate change is changing what's happening in the places that we live, and it's changing it differently wherever you are in the country. For California, that is wildfires. And that is an area that we're focused on. We're focused on how are the utilities responding to wildfires in California. They have a program to turn off the power as a way to keep their lines from breaking during dry weather with high winds, which can cause and spark wildfires. Well, that solves one public safety problem, but it creates another public safety problem for people with disabilities. So working with them directly, and Vance has been an amazing partner as we've tried to say, how are you addressing the problem you just created? Wildfires themselves, evacuations, preparation for that. We do training peer-to-peer, so people with developmental disabilities to other people with developmental disabilities on how to prepare. And the American Red Cross and the California Community Foundation have been great in granting us dollars to be able to buy Go kits to give to people with those trainings. Of course, when it comes to health and safety, the pandemic is this health crisis is still top and center of minds of people with developmental disabilities. You know, respiratory illness was the leading cause of death among people with Down syndrome and cerebral palsy before the pandemic. Then this virus comes along, and that's where it goes. That's where it lands. And so people with developmental disabilities is still we're very active as it relates to getting people PPE, getting people testing, and getting people vaccines. We have recently brought on a statewide coordinator for all those activities, Tamika Fitz-Rochelle, and she is here on the call today. So I just want to give a shout out to her and all of her amazing work.
Super. Thank you, Aaron. This has been amazing. We're talking about, you know, disabilities experts in particular areas of disability, law enforcement, of course, and emergency management is a key partner in all of this. And as an emergency manager, this is, you know, something that, you know, I'm well aware of and engaged in. And we've got Mark Sloan here. And Mark, would you like to speak about the role of emergency management in preparing the access and functional needs population for active shooter threats? We do preparedness planning. What does that involve?
Well, thank you again for the opportunity to be part of this excellent panel and part of the symposium. I'm a white male. I consider myself middle-aged. My kids consider me an old man. And my friends may consider me young at heart. I'm wearing glasses, and I'm also wearing a tactical button down that has my name and my organization on it. And it reminds me when I go to in front of a mirror who I am and who I work for. So it's an honor to be here. You know, my office in emergency management, again, being part of Texas, Houston is one of the 34 cities in Harris County. Being the third largest county, as you mentioned, with 3.8 million residents that are very diverse, my responsibility is to those individuals. And if you happen to be using a wheelchair or you happen to be an athlete, there's no difference to me. I have to be responsible for my entire community and make sure that the information is available to them. I'm also very fortunate to have a very large office of emergency management with 42 full-time staff, including a full-time functional and access needs coordinator. who works with that population and those groups, just like we work with our law enforcement partners, our fire and EMS partners. To me, they are equal in the conversation in planning for, preparing, and reacting to various situations, including active shooter. We conduct numerous first responder training and preparedness with all parts of our community throughout the entire county. And we take an all hazards approach because, as mentioned, is that sometimes we get very specific in the threat or the risk. But if we understand some basics of what we need to think about in being prepared for situations in the environment in which we function, it could be at work or school or in the community or just commuting or in our own homes, it's very important to understand what our true risks, threats are, and how we react to them. We provide ASL translation at most of our outreach events when it's appropriate, because we have to understand the audience in which we are communicating with. We will provide community emergency response team training in our community so that people understand how to take care of themselves, their family, and their property. More importantly, we looked at our functional and access needs population and said, hey, you can be part of this. And we worked with our deaf community and said, you can do this. I ran into an individual who was visually impaired as well as hearing impaired, and the individual told me that I can't do this. And I'm like, well, why not? Yeah, you can't do all of the things, but there are ways that we do things in life that we can adapt to. And it's understanding how those individuals, all of us, work together in order to be better prepared. So as an emergency manager, we have to take the whole community approach to preparedness. When we talk about terrorist activity or active shooter or tropical weather or wildland fire, it is understanding what our risks and threats are. So when people go through fire suppression in the CERT program or search and rescue or documentation or communication or the ability of understanding what our risks and threats are in our community, we all play a role and we can all learn from those opportunities to do the things that we need to do. The most important thing that I can tell anyone in any part of our community is be aware of our surroundings, understand where we are and what those risks are. You know, we've seen, unfortunately, the school shootings. We've seen the mall shooting. We've seen the events that happened in Highland Park during the 4th of July activities. I mean, in a mass gathering event, as we're enjoying the freedoms that we have as Americans to go to concerts or sporting events, remember, it's a mass gathering. And unfortunately, sometimes things do happen. And, you know, our law enforcement partners are going to be trained to react and respond. It's up to us as individuals to understand what our role is to survive that event. So in emergency management, our role is really to help provide strategic information and guidance in preparing for and planning to react if something bad were to occur.
Great, thank you, Mark. I find it very helpful, you know, when we can get in front of a community group and to engage in dialogue. Do you have any ideas for emergency managers who are interested in providing more opportunities for the community, but they just really don't know where to start?
I think that it's important that as emergency managers to remember what our role is, right? We're not tactical responders. That's Big Red and Big Blue, and they go do their job. I look at it as a strategic planner. I worry about tomorrow. When I am absorbed in tactics, I fail. So as emergency managers that are out there that are looking at the whole community approach and are wondering, how do I even get there, is connecting with the groups that you traditionally don't connect with. It might be faith-based organizations. It could be your local volunteer organizations active in disaster. It's reaching out to your community services department. It may be working with even your first responders and your EMS community who have already identified those that have access needs or are maybe homebound individuals. There's a lot of ways to think outside the box in order to meet the expectation of our role as emergency managers to take care of our entire community.
As emergency managers, do we think of businesses, right? Aaron brought up businesses. Do we think of businesses as a stakeholder that may need resources from us, informational resources or trainings, et cetera?
Yeah, absolutely. I mean, we do a lot of work with our business community in training their staff and the employees of those facilities, but it goes both ways. It's about partnerships. As we've talked about it previously, it's knowing who your partners are in a disaster, and it's not just first responders. Our business community is also equally engaged in our recovery efforts after an incident and can provide a variety of resources. You've got Lowe's and Home Depot, you've got Walmart, and a lot of different companies that exist out there that are willing to assist. And it might be monetarily or in goods and services, or just in volunteers that help us through the event.
For sure. Now, Chief O'Keefe, for law enforcement folks out there who may say, well, why should I why should I attend this active threat session that Mark is trying to get me to show up at this business meeting? Why should I send an officer to this? What's the argument? Why should law enforcement be a partner in this?
Well, like we like to say here in OES, with all our different directorates, it's one team, one fight. Everybody is important. Everybody brings something to the table. You can't effectively respond to a critical incident if you don't have the right people at the table. So besides, I would argue that that's your job to do that. And, it's not always about law enforcement. There's other entities that will be brought together to address whatever crisis it is. So we're just one component of it. So, that would be my advice to them. And I would also say too, that if you embrace community policing, then that's one of the pillars is working with the various members of your community.
No, thank you. And of course, Mark, fellow emergency manager, we always think about communication, alerting, and other kinds of communication. What unique resources do you use to communicate with the access and functional needs population where you are?
Well, that's a unique question, because communication is something that always everyone says fails during a crisis. It's who knew what, when, and why didn't I know it? And my job is to see if we can come up with the ability, not only through my public information officer and our press conferences, the ability to communicate properly, but it's also making sure people have timely, accurate, actionable information for those that we are talking to. So for many years, we've provided ASL translators during our news conferences. Our biggest hurdle was getting the media to include them on the screen. We thought we had done that, but then we started monitoring and having conversations with our media partners that yes, the scroller was fine, but not having the American Sign Language translator on screen became a detriment, and we heard about it and we improved that through the years. I've been very fortunate or unfortunate to have been involved in probably 6 of the top 10 worst disasters in the United States, from Katrina, Tropical Storm Allison, Harvey. I've been dealing with COVID as everybody else, and Winter Storm Uri. But we've learned a lot of different things throughout each one of those incidents in order for us to better communicate. And in that all hazards environment, we were able to secure, through our grant funds, services from DeafLink, in which we were able to put enhanced warning and alerts via our Ready Harris Accessible Alerts website, providing real-time resource for sensory impaired residents that typically they didn't have, and it's logistically appropriate. We communicate in American Sign Language, English, Spanish subtitles with narration, and compatibility with Braille readers. It is used to communicate emergency public information regarding terrorism and natural disasters. We have a library of information to help sensory impaired residents prepare for, mitigate the impact of those incidents. And they provide an opt-in capability to receive messages from our office in their preferred format and mode. I think that's a unique thing across that we have started working with our partners. And we communicate in English, Spanish, Arabic, Chinese, Mandarin, Vietnamese, and on our social media channels as well, to try to make sure that we are as inclusive as possible. And as diverse as we are, our entire country is very diverse. And we can say that if I have 10,000 in one group, it's that one individual that speaks a unique language or needs assistance that I miss. And so that whole community is technically, I have 4.8 million people. I got to try and figure out how to do the best we can with the resources that we have available in our emergency management. So we also have a 211 database in the state of Texas, which individuals can register. And when they register on that, that means that they have a medical need or an access and functional need issue and may need government assistance. And we've used that in a post-Katrina environment for many years. During the 2011 wildfires, we were able to reach out prior to fires approaching that community and ask the individuals, do you need help with evacuation? Do you need assistance? And in Hurricane Ike, we reached out to those prior to landfall to help them evacuate from the coast. And then after the event, we're reaching inland to those that didn't need to evacuate to find out their status and whether or not they needed any assistance. And Winter Storm Uri became very complicated because there was no power in the state. We had no water. It was all frozen. And I think the entire 4.8 million people in Harris County became functional and access needs individuals. They all wanted assistance. But it was about individual preparedness. And being able to do that, because government can't solve all issues and all problems for everyone every time. As best we would like to, it isn't always going to happen, and it falls back on the individual and preparedness. So we've done a lot of unique things in our communications in our public information office.
Thank you, Mark. What an exhaustive list. I'm watching the chat here, and there is a question for Aaron. Someone would like to know what's in the Go kits. You mentioned Go bags that were distributed.
Yes, the Go kits are standard issue from American Red Cross. It is their Go kits. The items are for a single person for 3 days worth of use. It has food, water. It has a handheld crank item to charge your electrical devices. There's blankets. There's a whole variety of items that are that could help someone survive through 3 days without other resources.
Super, thank you. Also noted, someone brought up, and I think this is important, folks who may have barriers accessing technology. How do we think about reaching them? I think this was in response to your answer, Mark, regarding communications.
Well, one thing that we'll do is we also do a home visit. I'll work through our dispatch centers in the county with our first responders, law enforcement, along with fire departments, that we pass out information too. So we have other materials that we have to go, but we'll actually do a wellness check and go see and get out to the community. Most people have a network of trusted individuals that they get information from, and we found that if we can help find those key force multipliers of communication, because we do know that there are areas that don't have technology accessibility as others do, that we got to make sure that we're trying to hit those areas to the best of our ability with the capabilities that we have. And sometimes it's just a piece of paper, in the language that's understood, or coordinating with the persons, individuals, organizations that are communicating with those individuals.
Thank you. Just wanted to ask, and this is going to Vance, you know, we've kind of almost circling back to that question about moving the needle. And this relates to the question I asked Aaron about the future. It seems like we have a lot of great resources here. And as you noted, the symposium is being recorded and links will be made available to all registrants. So don't worry, there will be links for all of this. It seems like there are a lot of materials being circulated. And I think of AFN work is there are a lot of people, you know, doing great work over here and over there. Vicki Davidson sends out, you may be on her gigantic email chain. She sends out a bunch of stuff. There's the group that Sadie leads nationally. There's all kinds of work being done. And yet centrally it's challenging, right? How do we move the needle so that we have, you know, sort of a centralized, more centralized approach? And Vance, what do you think?
Yeah, another great question. So we're seeing a lot of great work happening, right? And we're hearing about that. And by the way, all the links and the documents, the resources that have been discussed, not just by this panel, but throughout both days of the symposium, we're going to put together a very large list. And then we're going to send those out to everyone. So I know we've got a lot of questions about that. One of the things that we've done in California is try to tackle this exact issue that you're bringing up. Because what would happen is I'd go to meetings or conferences, or I'd just get emails, and people would say things like, hey, I saw this guidance, or I heard about a best practice guide document. I can't remember where it was. How do I find it? And so what we did was we developed an Access Electoral Needs web library, and we put it on the Cal OES website. So if you go to the Cal OES website, there's a link for the Office of Access Electoral Needs. And then on the right, you'll see AFN library. And it's a central repository for all of those documents and all of those resources. And the key was to make it just sort of a one-stop shop. And so we do a couple things. One is we take resources, we upload them to the library, we annotate so people know what they are. It's searchable, it's by subject. And then as we come across other resources, or as people produce documents and resources, they send them to us, and then we'll continue to add to that library. I recognize that there's no such thing as a truly comprehensive site, but there are other efforts that are happening. IAEM is making some strides. I know Dawn and her team are making some strides. I know that, you know, Sadie's very active and doing stuff. And so I love the fact that we are seeing these pop up across the country. Right. And I think that that's good. I think that we should have as many of those groups as possible, and that then have an opportunity to come together in this type of a forum or symposium to be able to share and talk and express things about successes or barriers with our partners. So a lot of great work happening. By the way, the Cal OES website is being updated literally today. And so if you go on there to try and access the AFN library, it may not be available today, but it will be tomorrow. Just putting that out there.
Hey Vance, this is Aaron. I got a new one for your library that's coming out from the guidance that we created. You know, it's written for law enforcement. It's written for employers. It's not exactly written for people with developmental disabilities. So we took it and we put it into a plain language interpretation, which we have in English. It's all formatted, ready to go, and we'll have it in Spanish before this month's out. So we'll get those out, we'll get those distributed, and would love to get it over to you for an addition to your library.
Absolutely. And you know, that just hits the nail on the head. What we were talking about earlier, because we want people to use that resource and customize it and tailor it and make it work for them. The other thing that we've been talking about is actually forming another work group and revising or updating that product, because it is a couple years old and things have changed. And so, I'm going to be talking to Chief O'Keefe, and we've already kind of talked a little bit about this. And Aaron, of course, know that you'll be on the hook. And some other stakeholders. So don't be surprised if you see an updated guidance coming through.
That's great, Vance, glad to do it. And Anne Marie, thanks so much for the shout out to Vicki Davidson. She is my counterpart from Missouri. She runs the Missouri DD Council. She's here at the conference with me. And I'd already let her know about the plain language guide. So she's, oh, when can I get that? So whoever's on her list, I bet you a nickel you're about to get it. So that we'll get it distributed to you.
Super, super. Thank you. And give her my best. I've never met her, but she's always popping up in my email inbox with lots of great stuff.
So Anne Marie, we've got, I just thought about this. We've got, let's see, like Mona Curry in Hawaii, and then go all the way across the ocean. You've got, I'm in California, then you got Sadie and Don and others and Mark, moving all the way over to New York, where you're at. So when we say coast to coast, we mean coast to coast to coast to coast, this subject has really grown, and it's due to the hard work of a lot of people. So this was fantastic.
It really is exciting because, when I first started doing this kind of work, it seemed like there were these specialists over here, those people over there worry about the people with disabilities. This was back in the days of the special needs plan, right? Special other, and I think we've really come a long way to talking about whole community inclusion and assuming that people with disabilities are in the room, because they should be, right? And collaborative planning and really increasing the knowledge of every emergency manager. So it's not just those specialists over there, but every emergency manager knows about access and functional needs and planning for people with access and functional needs. Just to round up, Sadie's telling me we have 10 minutes. So to round up, I think the last panel was a great job, a great way of rounding up by talking about, what should be on folks' to-do list? What should people do? Does the panel have any advice for folks who are interested in increasing the capability of their community for access and functional needs preparedness for active threat? What advice do you have, if you have one or two things for people to consider doing?
Just from my perspective, get involved, be part of, focus groups, and, have a wide variety of expertise at the table.
Great advice. Mark?
This is Mark again. My advice is, because of the diversity that we have in the audience, from emergency managers, from partners that work directly with the various populations that we're discussing, is make sure that we're connected. Connect with your local emergency management office and find out how you can be involved. As much as I look for partners, sometimes people are hard to find. And the only time I find them is during a crisis, and that's too late. So connect now if you can. Reach out. If it's a city, find your city emergency management agency. And if it's a county, work with your county. And I even recommend reaching out to your state emergency management agencies so that they can reconnect you at the local level. But you also need to understand that there's a variety of levels of assistance that can be provided. So create those relationships today.
It's great advice. Aaron.
I think any emergency planner is going to be really excited about what I'm going to say, but my advice to people with developmental disabilities and their families or any access and functional needs is to plan and prepare. Just knowing exactly, again, with your abilities, your strengths, what you can do in those moments, takes a little bit of extra planning and preparing. Additionally, during the pandemic, we did a partnership with the governor's office that was a neighbor-to-neighbor approach. The idea was to reduce the isolation that came along with the pandemic. First thing I heard from people with developmental disabilities was the loneliness. So we launched with the governor's office, a neighbor-to-neighbor, but there was another benefit to this, which is in any emergency, the first responders are actually not the first ones who get to you. Your neighbors, the people right physically next to you are the ones who can get to you first. And so developing those relationships, knowing who they are, them knowing who you are, and knowing what needs you may have if there is an emergency and you're at home. So that's an extra tip for preparation and planning.
That's great. A great reminder. Vance.
Yeah, so I think there's a couple. One that I would say, and this is kind of taking a step back on the overall conversation. So California does have a very unique setup. Right now, we're the only state in the country where the governor appoints a chief to serve as the lead of the Office of Access and Functional Needs. And that individual, their job is to brief the governor and the director of OES on these issues. To identify what are the needs before, during, and after disasters of all Californians, and then work with our partners in that process and in the process of integrating those needs throughout every facet of the emergency management process. So, when those discussions happen about everything from COVID to active shooter to how are we going to approach wildfires, it works because there's someone in the room. Now, I'm fortunate to have had that post for the last 7 years. But there's someone before me, there'll be someone after me. It works because there's someone in the room when the decisions are being made. And it's not that, it always goes the way that I think it should go, right? But I can tell you 100% that the voice, is listened to. The perspective is wanted. And seeing how far the governor and Director Gilliducci have gone to be inclusive is, to me, reaffirming of why I go to work every day. Other states, I know, are set up a little differently, but I would just encourage and implore everyone on this symposium to push for that level of integration at the upper senior level executive levels, to be able to be a part of the conversation there. So that would be kind of my big push. And then I would just say, get to know your partners. And any success we've had is because we've worked with our partners. That's just the way it is.
Excellent. Well, thank you. I think this has been a great panel. There have been so many important resources mentioned. As Vance indicated, there will be follow-up to this, so don't worry if you were trying to write something down and you didn't quite get it. We will be providing the links and all of the resources